Hello everyone, welcome back. I'm your host, Mr. Meds, aka King Meds, and Kosia Makambi. On our previous two videos, we discussed paracetamol and aspirin. Now that I've already discussed those two molecules, today I want to discuss the combinations that are available on the market for those two molecules. From now on, this is how the segment is going to work. So what I will do is, if I discuss a molecule and then there is a combination that is available with another molecule that I've just discussed, then I'll make a separate video of combinations that are available. For example, now I've discussed paracetamol, I've discussed aspirin. So I'll make a video of combination of paracetamol and aspirin combinations that are available. If there are any topical creams or ointments available, then I will also discuss those in this separate video, if I can say. So today we're gonna discuss the combinations of aspirin available, and then I'll quickly also go on topical applications that are available in the market. So I won't be able to discuss combination of molecules that I haven't discussed. For example, if there is a combination of paracetamol and ibuprofen, because I haven't discussed ibuprofen yet. So once I start discussing ibuprofen, then I will discuss the available product that contains the molecules that I've already discussed on the previous video. So most of the products that are found either over the counter or in the front shops are combinations. So this means that it is very important for you as a customer to know what ingredient is available in which product. That will help you to avoid duplication and overdose. Without wasting any of your time, let's start with the most common combination of paracetamol and aspirin that are found in the country. Let's start with the most common one. The most common one is Grandpa. Grandpa is a combination of both paracetamol and aspirin. There is also caffeine here and there. So as Grandpa contains aspirin and paracetamol, that means the previously discussed contraindication on aspirin and paracetamol applies to Grandpa. So if you want to know who should use Grandpa or other related product that contain paracetamol and aspirin, you can watch my two previous videos which I talked about paracetamol and aspirin. So these combinations usually are indicated for headache, toothache, pain and fever. This is not the only combination available on the market. You find other combinations like Compral, that's also one of the common ones, and then there's a new one now they call Tripec. That's also one of the combinations that contain paracetamol and aspirin. You should be aware of these products because you can get these products in the front shop without any prescription. In fact, you can get it in any retail shop. So this makes it very easy to misuse them if you don't know what you're doing, because you can easily duplicate on this product if you don't know the active ingredients in them. Because they are easily accessed, these are one of the mostly misused products in the country. A huge number of people have actually start developing dependency on these products. This is quite dangerous because these products are not good for a long run. Like other aspirin containing product or other anti-inflammatory product, when it comes to these products that contains aspirin and paracetamol, because there's still aspirin in those products, aspirin is a non-steroidal anti-inflammatory. So as I said, most non-steroidal anti-inflammatory, what they do is that they degrade your stomach, that lead to ulcers. It's basically the same thing with these combinations as well. What they do is, if you use them more frequently, then what ends up happening is that they eat your stomach, degrade your stomach, and you end up having ulcers. And people don't take ulcers serious, as ulcers are a very serious problem. So ulcers are very serious in such a way that they can kill you or they can be fatal. So what usually happens if you use too much of these combinations is that they will eat your stomach and also thins your blood. If you find a common cause of death for people that were using this product, they will say the victim just vomited blood. That is a sign of ulcers that were in a late stage. So if the ulceration is too much, then what happens is that the person might bleed to death. So the stomach irritation will open and then the person bleeds, because as I said, aspirin is also a blood thinner. So it thins your blood and then you vomit blood and you lose too much blood, then you die. There's nothing more difficult like stopping a gastric ulcer or stomach ulcer. So most doctors can't even stop the gastric bleeding because it's quite difficult to reach the stomach. So it is very important that you use this product with caution when you're using them. Don't fall victim to this product. They are actually very addictive, I know, but they're also too dangerous. So all the side effects that I've mentioned above relating to aspirin or paracetamol, they apply to these products. So unfortunately, you get both side effects from the aspirin and paracetamol from this product because they're a combination. One of other products that usually contains aspirin is med lemon. People are not aware that med lemon contains aspirin already. So what I've seen some people doing is that they take med lemon and then add another aspirin tablet on that combination. If you already know that med lemon contains enough aspirin, you wouldn't be doing that. So the recommended aspirin per dose is 1000 milligrams. So med lemon usually contains 800 milligrams per 7. So if you add another aspirin on that, you're easily exceeding the dose of aspirin, and that lead to complications that I've discussed before. When you buy a product at the pharmacy or at the shop or retail shop, it is very important to know what it contains to avoid duplications, because I mean these are easily accessible products. You can easily mix med lemon with grandpa in the same time without knowing that the med lemon already contains grandpa, or you just put grandpa med lemon aspirin in a med lemon, not knowing that there's already enough aspirin in a med lemon and aspirin is another aspirin. So you should be able to interpret this product and know what is in that product and avoid duplication, because it can be a very dangerous thing to do. So all these products that I've mentioned and the one that I've mentioned on the aspirin video should not be taken with other anti-inflammatories at the same time. So if you have let's say grandpa and ibuprofen, those should not be taken at the same time. You can alternate between the two, but not at the same time, because they are both anti-inflammatories. Then if you take them together, you're just increasing the side effects, not the effectiveness of those two products. You end up having more side effects than when you are using one product at one time. So that is very important to know. You cannot use NSAIDs or non-steroidal anti-inflammatories together, but you can use paracetamol with almost all the anti-inflammatories, because as I said, paracetamol is not really an anti-inflammatory. It actually works so well with most anti-inflammatories. Now let's quickly discuss topical applications. When it comes to topical application, aspirin or acetyl salicylic acid cannot really be used for topical application. However, aspirin or acetyl salicylic acid is made from salicylic acid, which is basically a mother molecule of aspirin. So I will just discuss that, and then I will later go to the other one that we use for inflammation, that is also like a sister of aspirin. So let's start with that. So salicylic acid is an ingredient that is mostly used in cosmetic products. So basically salicylic acid is one of the ingredients that is used mostly in beauty products for reducing pimple swelling, reducing redness, and unplugging pores. This all makes sense because salicylic acid is an anti-inflammatory. That's one of the most uses of anti-inflammatories. They reduce swelling, they reduce inflammation, and they also reduce redness. Obviously, redness is mostly associated with swelling, also unplugs pores. It is usually found in very low quantities, 1 or 2%. That is because in very high quantities, salicylic acid is very irritating. So they usually use it in very low quantities in cosmetic products. You will see most of your cosmetic products have salicylic acid in some way, especially those that you will be using for exfoliating to reduce pimples and all that. They will mostly contain salicylic acid as one of the ingredients. When it comes to salicylic acid, it is so irritating to the skin, but it is not really absorbable by the skin. So it doesn't really go deep into tissues when applied into the skin, but it can be so irritating in the skin that if you just apply it straight into your skin, it can open wounds, or if you already have wound, it can be irritating to the wound and actually eat the wound and open it further down. So you won't really find it in products that are used like on open wounds. You won't find products like that. If the wound is open, then you rather never use it in an open wound. Salicylic acid is so irritating that it is actually found in most of the combinations that are used for removal of warts or tags. Most of the front shop tag removers contain salicylic acid in higher percentage than the one that are contained in beauty products. So you'll find it like 15%, 13% salicylic acid. Those are the products that you will find, like skin remover, tag remover products that you find in the front shop. But there's also like a over-the-counter product that contains salicylic acid that is indicated for warts remover, cones and tags. So that product is called Wart Magic. So Wart Magic contains salicylic acid as well. So that shows you that salicylic acid is very irritating to the skin, that it can be used to as a keratotic agent or exfoliating agent, or keratotic agent, that if I can say. So it is used to remove cones, can be used to remove warts as well. But it's so irritating that when you're applying it to a skin tag or to a wart, then you have to apply a thin layer of Vaseline or petroleum jelly around the skin tag, or a skin tag or the wart, just to prevent it from damaging the normal skin. Because if it happens that it falls to the normal skin, then what happens is that it can eat your skin and open a wound or ulcer. In some cases, actually, doctors can prescribe a mixture of salicylic acid up to 50% that a customer or patient will use on their wart. So that is like high percentages of salicylic acid. 50% is quite a lot. So they prescribe those percentages on to help with wart removal. And then usually most pharmacies don't really keep salicylic acid because it's actually very irritating, and it's very difficult to mix and very irritating. So when it comes to salicylic acid, if you mix salicylic acid and then it happens to get into your nose or your mouth, then it burns, and it is so irritating. It actually can burn and irritate your nose that you might end up having ulcers. It's so irritating to the mucosa. When it comes to mouth mucosa, the nose lining, that most pharmacies prefer not to keep it. Actually, in most mixtures nowadays, there are other exfoliating agents, so it is not actually, you get few dermatologists that are still prescribing it, but it is the usage of that has now decreased a lot. In the olden days, it was used a lot by dermatologists, but now not anymore, because there are other options available on the market. Besides all these products, salicylic acid is actually a good exfoliating product. So you'll find it in most of the exfoliating products on the market. Most of them contains salicylic acid for exfoliation and to help with pimples, swelling and redness. It is also actually found in most pimple patches. There is salicylic acid in most pimple patches. That also, as I said, helps with opening up pores, redness and swelling, or that swelling, because pimple is basically a swelling. However, when using an salicylic acid containing product for exfoliating or anything else, it is advisable that you use it in the evening and then wash it off in the morning and apply a sunscreen during the day. It can increase the skin sensitivity to the sun, So that's why it is very important to apply a sunscreen if you are using anything that contains salicylic acid in your body, especially in the face. Must never be ingested because, as I said, it is very irritating to the gastric mucosa or the mucosa in general. So it is very irritating that it can cause ulcers or ulceration of your stomach and cause leading to bleeding, same side effect that you find on aspirin. So if you want like an oral version that is better, is better than salicylic acid, so obviously you get like aspirin, which is acetyl salicylic acid. Aspirin is like the oral version of salicylic acid, so it's, yeah, you can use that orally if you want to ingest salicylic acid. As I said, salicylic acid is not really absorbed into the skin, so it doesn't really help with inflammation that are in deep tissue. So like your muscle inflammation, your muscle pain, it doesn't really help with that. It just helps with topical inflammation that will be your warts or your pimples and open up of the pore, but it doesn't really work for deep tissue injuries, so it doesn't really work for that. For that, you have another molecule called methyl salicylate. That did chemistry, they will tell you that aspirin and methyl salicylate come from the same parent, which is salicylic acid, but aspirin is just a product of acetylation of salicylic acid, and then methyl salicylate is just a methylation of salicylic acid. So that means these two products might share similarities, just that the other one cannot be taken orally. Methyl salicylate can only be used for tissue inflammation or muscle inflammation, something like that, but aspirin can only be taken orally as well. It can't be used for the other topical application. So when it comes to muscle pain and injuries, then you have methyl salicylate as one. As I said, it is actually one of the most commonly used topical anti-inflammatories. So methyl salicylate product includes rub, your wintergreen, deep heat, and other methyl salicylate products. So those one are used, as I said, for spot injuries, deep muscle injuries. Like salicylic acid, methyl salicylate can penetrate the skin and go to the muscle and help with inflammation and pain that is related to muscles. So as I said, one of the most common uses of this product is of methyl salicylate product is for spot injuries, inflammation, and muscle pain. So you can use it for that, and it can also be used to increase blood circulation. So if you apply it, actually helps to open up your veins and increase blood circulation. If you have cold hands, you can actually rub it, or you have cold feet, can actually rub it around your feet. That actually helps to open up the veins and help with increasing your blood flow. Although methyl salicylate is not really toxic to the skin, but it can also be absorbed by blood vessels if too much quantities are applied to the skin. When absorbed by the blood vessel, then it exhibits the same side effect as aspirin, which is all the side effects that I've mentioned on my previous video regarding aspirin. So when it goes to the body, the same side effects show up in the body. So to people that are like on warfarin and all the especially warfarin, the people that are on blood thinners, including warfarin, especially warfarin is a problem, should not use anything that contains methyl salicylate. They can use anything contains salicylic acid because basically salicylic acid is not absorbed into the bloodstream. But when it comes to methyl salicylic acid, because it penetrates the muscles and skin, then it can be absorbed by the bloodstream, and then in high quantities it can cause damage. Must be cautious when you're using this product. I hope this video was not confusing. I know I threw too much new words, but if there's any confusion, just go into the comment section below and you can ask a question. I'll try to attend as many questions as possible. Other than that, stay on meds for more clarity, not confusion, one med at a time. See you on the next one.